AV Blocks Lecture 3, Second Degree Type II, or Mobitz 2, Second Degree AV Block. Define Mobitz 2 Second Degree AV Block. List the diagnostic criteria for a Mobitz 2 Second Degree AV Block. Identify a Mobitz 2 Second Degree AV Block by utilizing the rules of ECG interpretation, and define a 2-to-1 AV block and list the diagnostic criteria. In a Mobitz 2 Second Degree AV block, our goal ultimately is to try to prevent Mobitz 2 from becoming complete heart block. The QRS complexes can be narrow or wide depending on the site of the block. Remember, it can be higher in the AV node or it can be down in the bundle of His. A dangerous block that can proceed to complete block easily. And it could be a permanent type of defect that causes this type of block. It's more serious in first degree block or Mobitz type 1, and it indicates an increased risk of progression to third degree, just as I mentioned. It occurs when there is an intermittent interruption of conduction near or below the AV junction. In a second degree AV block type 2, the SA node is generating electrical impulses at a regular rate. So the P waves are going to occur in a regular pattern across the EKG strip. Some P waves are not followed by QRS complex. So when we're going through our rules and we're going to check, is there a P wave for every QRS? The answer will be yes. But is there a QRS for every P wave? And the answer is no. The impulse is blocked in one bundle branch and has partial block of the other. The AV node is a gatekeeper to the ventricles, and just as I had talked about in the previous lecture, you think of it as like a bouncer in a club. It decides which conductions go in and which conductions do not go in. It closes at regular intervals, and a closed gate equals no ventricular impulse, and there's no QRS that is produced. One thing that's very important to remember about a second degree AV block type 2 is that no matter what the PRI length is, the PRIs are going to be constant. So when you have a second degree type 1, you have a progressively widening PRI, but with a second degree type 2, the PRIs are going to always be constant. So the gate is closed in your first complex, the gate is open, the gate is open, the gate is open, but look, the gate is now closed again. Either single or multiple non-sequential, non-conductive P waves in the face of the rhythm with a constant PRI intervals is characteristic of this strip. P to P intervals are constant throughout the strip. Remember, the SA node or the atrial conduction is continuing to conduct at a regular rate. It's the AV node or the AV junction that's not allowing for the conduction to go through. The PR intervals are regular for conductive beats. The atrial rhythm is regular, just as I mentioned, but the ventricular rhythm is going to be irregular because you're going to have a disruption in the R to Rs. So here's some examples of a Mobitz 2 second degree AV block. Again, notice that your PR intervals are constant with every one of these. So this is a 3 to 2 conduction, this is a 4 to 3 conduction, and this is a variable conduction. So my rules. What is the rate? The atrial rate's regular, the ventricular rate may be bradycardic, depending on the degree of the block. The rhythm, the atrial rhythm is regular, the ventricular rhythm is irregular. Is there a P wave before each QRS? Yes. Some P waves are not followed by a QRS complex, though, so there's not a QRS for every P wave. The PR, again, is constant for conductive beats. Do all the QRS complexes look alike? Yes, but they're intermittently absent, and they should be less than 0.12 seconds because, again, the issue is at the AV junction, not at the ventricles. So let's look at an example here. So I've got a 6-second strip with a ventricular rate of 50, but I've got a much higher atrial rate of at least 80. It is irregular because I've got a disruption in my R to R intervals. My P wave is present and upright. My PR interval is constant at 0.18 seconds across the board. My QRS is narrow at about 0.08 seconds. But because I've got a constant PRI, but dropped complexes, this is a second degree AV block type 2. The same thing with this strip, except we've got a lower ventricular rate of 40 and we've got a atrial rate of 60. It's irregular because I've got a disruption in the R to Rs. My PRI is 0.16 and again constant for all of my conducted beats, but I do have intermittently dropped QRS complexes. It is a second degree heart block, Mobitz 2. So the most significant thing about a second degree Mobitz 2 is that it may progress to a third degree heart block. Our goal is to keep any of these higher degree heart blocks from progressing to a higher degree heart block. The frequency of the drop beats is a major concern. As we saw, you could have a ventricular rate that varies based on the amount of times that the AV junction allows the conduction to go through to the ventricles. Cardiac output may be seriously compromised, especially when you have higher amounts of drop beats. Be alert for signs and symptoms of decreased perfusion.